Cancer is one of the leading dangerous diseases today, not only threatening human life, but also leaving a great burden on families and society. Understanding the causes, effects, as well as prevention and treatment methods is essential to protect health and improve quality of life. Let's find out together with daily knowledge in today's video. If you find the content useful, please like, share, and subscribe to the channel and turn on the notification bell so you don't miss the next videos. Now let's begin. What is cancer? Cancer is a group of diseases characterized by the abnormal growth of cells that divide uncontrollably and have the ability to invade and destroy normal body tissues. Most cells in the body have a specific function and a fixed lifespan. During regulation, a cell receives instructions to die, and the body can replace it with a newer, better-functioning cell. Cancer cells, however, lack the factors that instruct them to stop dividing and die. This results in an accumulation in the body, using oxygen and nutrients that would normally nourish other cells. Cancer cells can appear in one area, then spread through the lymph nodes. Some types of cancer cause rapid cell growth, while others cause cells to grow and divide at a slower rate. There are more than 100 different types of cancer. Cancer is often named after the organ in which it originates. For example, lung cancer originates from cells in the lungs. Colon cancer originates from cells in the colon. Cancer can also be named after the type of cell that forms it, such as carcinoma or connective tissue cancer. In addition, cancers can develop from the blood, such as malignant blood diseases. What is the difference between cancer cells and healthy cells? Cancer cells differ from normal cells in that cancer cells are less specialized than normal cells. In addition, cancer cells have the ability to ignore signals that normally prevent cell growth and division, such as programmed cell death, signals that help the body get rid of unnecessary cells. The immune system is normally capable of removing and destroying damaged or abnormal cells from the body, but cancer cells can be invisible to the immune system. Furthermore, they are also capable of taking advantage of the immune system, which can evade the body's immune response to survive and grow. Cancer cells can affect the normal cells, molecules, and blood vessels that surround and nourish a tumor, an area known as the microenvironment. For example, cancer cells can make nearby normal cells form blood vessels that supply oxygen and nutrients to the tumor. These blood vessels also remove waste products from the tumors. So what are the symptoms of cancer? The signs and symptoms caused by cancer will vary depending on which part of the body is affected, as well as the stage of the disease's development. Basically, in the early stages, it is difficult for the body to notice any different signs. However, some general signs and symptoms related but not specific to cancer can include fatigue, unusual weight changes, including unintended loss or gain, skin changes such as yellowing, darkening, or redness of the skin, a sore that does not heal or a change in an existing mole, persistent cough or shortness of breath, difficulty swallowing or hoarseness, persistent indigestion or discomfort after eating, persistent muscle or joint pain, unexplained bleeding or bruising. The causes of cancer can include DNA mutations. Cancer is caused by changes, DNA mutations, in cells. The DNA inside a cell is packaged into a large number of individual genes. Each gene contains a set of instructions that tells the cell what functions to perform, as well as how to grow and divide. Errors in the instructions can cause the cell to stop functioning normally and can allow the cell to become cancerous. These mutations are the most common mutations found in cancer. But many other gene mutations can contribute to cancer. Unscientific lifestyle. Daily lifestyle is also considered a factor that increases the risk of cancer. Smoking, drinking more than 1 glass of alcohol per day for women of all ages and men over 65, or 2 glasses of alcohol per day for men aged 65 or younger, excessive sun exposure or frequent sunburn, being obese, and having unsafe sex can contribute to cancer. Due to genetics. If cancer is common in your family, it is possible that mutations are being passed from one generation to the next. You can have a genetic test to see if you have inherited a mutation that increases your risk of certain cancers. Remember that having a genetic mutation does not necessarily mean you will get cancer. Some chronic health conditions, such as ulcerative colitis, can significantly increase the risk of developing cancer. Therefore, people with chronic diseases need to see a doctor and monitor their health regularly. Environmental pollution. The surrounding environment contains toxic chemicals that can increase the risk of cancer. Even if you don't smoke, you can still inhale smoke if you go to a place where people are smoking or if you live with a smoker. Chemicals in the home or workplace, such as asbestos and benzene, have also been linked to an increased risk of cancer. How does cancer develop? Tumors are also divided into two types, namely benign tumors and malignant tumors. A benign tumor will grow to a certain level and then stop. Malignant tumors will grow indefinitely. The excessive cell growth leads to compression, causing damage to neighboring cells. It will not stop until there is nothing left to destroy. Worse still is when these malignant cells metastasis, move to other areas, causing a risk of death such as in the brain, heart, lungs, etc. Cancer is born from the transformation of genes that control cell function, especially the genes that control cell growth and division. Researchers recognize that each cancer cell contains many mutations. There are some mutations that can be seen in many different forms of cancer. Cancers that are the same in terms of histological morphology respond to treatment differently, and therefore the prognosis is also very different. For example, the group of colorectal cancers without KRAS and BRAF mutations have a better prognosis than the group with mutations in one of these two genes. Therefore, the frequency and types of gene mutations are now commonly used to subdivide cancers. So what complications does cancer cause? Having cancer can cause a number of complications, including pain. Pain can be caused by cancer or cancer treatment, although not all cancers are painful. Fatigue. Fatigue in people with cancer has many causes, but can often be managed. Fatigue related to chemotherapy or radiation therapy is common. Shortness of breath, nausea, diarrhea or constipation. Cancer and cancer treatment can affect your bowels and cause diarrhea or constipation. Weight loss due to cancer cells using nutrients from normal cells. Changes in your body's metabolism. Cancer can upset your body's normal metabolic balance and increase the risk of serious complications. Signs and symptoms of a metabolic imbalance can include excessive thirst, frequent urination, and constipation. Problems with the brain and nervous system. A tumor can press on nearby nerves, causing pain and loss of function in a part of the body. Cancers involving the brain can cause headaches and stroke-like signs and symptoms, such as weakness on one side of the body. Abnormal immune system response to cancer. In some cases, the body's immune system may react to the presence of cancer by attacking healthy cells. Called a paraneoplastic syndrome, these very rare reactions can lead to a wide range of signs and symptoms, such as difficulty walking and seizures. As cancer progresses, it can spread, metastasize, to other parts of the body. People who have been treated for cancer are still at risk of recurrence. You need to consult a doctor to be able to come up with a follow-up care plan. This plan may include regular scans and checkups during the post-treatment period to look for cancer recurrence. So what are the methods of cancer treatment? Doctors often provide treatment protocols based on the type of cancer, the stage of diagnosis, and the overall health of the patient. Here are some current cancer treatment methods. Chemotherapy aims to kill cancer cells with drugs that target abnormally dividing cells. The drugs can also help shrink tumors, but the side effects are often serious. Hormone therapy involves taking drugs that change the activity of certain hormones or interfere with the body's ability to produce them. When hormones play an important role, as with prostate and breast cancer, this is a common approach. Immunotherapy uses drugs and other treatments to strengthen the immune system and encourage it to fight cancer cells. Precision medicine, or personalized medicine, is a newer, developing approach. It involves using genetic testing to identify the best treatment for a person with cancer. Researchers have not yet shown that it can effectively treat all types of cancer. Radiation therapy uses high-energy radiation beams to kill cancer cells. In addition, your doctor may recommend using radiation to shrink a tumor before surgery or to reduce tumor-related symptoms. Stem cell transplantation can be especially beneficial for people with blood-related cancers, such as leukemia or lymphoma. Surgery is often part of a treatment plan when a person has a cancerous tumor. In addition, a surgeon may remove lymph nodes to reduce or prevent the disease from spreading. Doctors will often use more than one type of treatment to maximize effectiveness. How to prevent cancer? There is usually no method to absolutely prevent the risk of cancer, but doctors have identified a number of ways to reduce the risk of cancer, such as quit smoking. Both active and passive smoking are associated with several types of cancer, not just lung cancer. Not only you, but also your loved ones around you need to stop smoking, which will reduce the future risk of cancer. Avoid excessive sun exposure. Harmful ultraviolet UV rays from the sun can increase your risk of skin cancer. Use protective clothing or apply sunscreen if you have to go outside. Eat a healthy diet. Choose a diet rich in fruits, vegetables, whole grains, and protein to boost your health. Exercise regularly to help reduce the risk of cancer. Maintain a healthy weight. Being overweight or obese can increase the risk of cancer. Therefore, to achieve and maintain a healthy weight, you should do so through a combination of a healthy diet and regular exercise. Cancer screening. Talk to your doctor about what types of cancer screening are best based on your daily cancer risk factors. Vaccination. Vaccination can help prevent some viruses that cause cancer. So, in a few minutes, we have just learned about cancer. It is a very dangerous disease, but it can also be cured if detected and treated in time. Thank you all for watching the video. Please leave your comments and share. And don't forget to subscribe to the channel to always be a companion in the next videos. Goodbye and see you.